Welcome, welcome, my dear friends. Myself is retired Professor Dr. Rajendra Raghuveer Deshpande. I would like to welcome you in this interesting video, which is regarding the Parkinsonism, Parkinson's. Nowadays, my dear friends, these neurological problems are increasing in the society. When we practice, we see many patients, the problems are connected with the brain and the nervous tissue or the nerves. I will give you the few examples. Hemiplegia, from a longer time, it was there. It is there and it will be there. I have already uploaded the video regarding the hemiplegia. But now I am seeing that because of our fast lifestyle and fast food, we have the degeneration, fast degenerative process. Why? Fast life, hectic lifestyle, plus fast food, junk food, then that gives the fast degeneration, especially the neurological cells are getting degenerated. And you try to understand while considering the all other tissues, blood, muscle tissue, bony tissue, everywhere in every cell, there is a probability of good regeneration. After degeneration, there will be regeneration. But there is an exception of the nervous tissue. The nerve damage cannot be regenerated as like the other cells or the tissue. So this is very interesting. That's why nowadays we should be very careful for the senior citizens. Aging process is there. And early in the life, 40, 50, the people are suffering from many neurological problems. Tingling, numbness, headache, it starts from very simple things. Then transient ischemic attack to the brain, claudication, hands becomes cold, tingling numbness is there, and then severely hypertension, and because of the hypertension, bleeding, thrombosis, embolism, hemiplegia. Then there is a problem of Parkinson. This is also a deficiency type of disease. Then there is a, although it is a rare, but there may be myasthenia gravis, Amitabh Bachchan's disease, myasthenia gravis. That I also going to discuss. Then there will be problems, or there are problems of senile dementia, memory loss. Many old people are suffering. Their quality of life becomes hampered. This is the important statement in this video. But before that, let me make my screen big so that visualization will be greater. I am talking to you about the nervous tissue problems. And I am saying you nerve tissue, nerve cell regeneration is very difficult. So better prevention is better than cure. And all these neurological problems, they have the allopathic treatment good in the acute condition, symptomatic treatment. But I will request all of you, in many systemic diseases, Ayurveda should be added in the management program of any disease. So allopathy and Ayurveda, mixopathy, holistic treatment should be carried out. Try to understand. Huh? So I had mentioned about senile dementia, loss of memory. And what is the serious problem? Yes. Alzheimer's disease. This is also very common nowadays. Very common. Then what is the else you can talk about? Multiple sclerosis. Very problematic. Motor neuron disease. Some may not be have heard about this, but these problems are increasing nowadays. So my dear friends, look, study, observe this video very carefully for whole the length. These are all educational videos, my dear friends. So they are useful for the students of medicine, any medicine branch. Allopathy, Ayurveda, homeopathy, naturopathy, physiotherapy, pharmacy. Each and every student is getting benefited by Professor Deshpande's videos. Many compliments are there. Sir, your videos of medicine are very excellent because they are giving short and sweet information, pinpointed information. Yes, because myself, Professor Dr. Rajendra Deshpande, retired of course, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. My personal website, this is my WhatsApp number 9226810630. This is my mail ID. Why you can mail me? Whenever you find that you have the health problem, you want to take the help of Ayurveda and you don't find any good Vaidya nearby, then my huna, I do the online paid consultation. I do the palmistry consultation. I do the lifestyle counseling based on your prakriti, Ayurvedic biotype. Then I can tell you what food you can eat, what food you should avoid, which occupation you can follow, what should be your lifestyle, this and that, which are the best rasai and tonic. Everything I can tell. I do take the online classes, private tuitions of the medical students, especially Ayurvedic students. Now, whether you practice allopathy, Ayurveda, homeopathy, naturopathy, nothing matters. Every pathy is good. Sympathy is the best practice. So, but anywhere, any health problem, you should try to find out the root cause. Etiological factors are very important, and that gives you the differential diagnosis. In Ayurveda, it is called as a Vyadhi Vyavachedaka Nidan. Basic management principle. Again, whether you pathy, allopathy, Ayurveda, homeopathy, naturopathy, what should be your target when you try to treat any disease? Sankshepathah Kriya Yogo Nidana Parivarjanam in Sanskrit, and translation. Management principle is try to avoid, remove, and treat the causative factors. Parkinson's disease is also called as paralysis agitans. I will tell you why I have made this action. Agitans, I will explain you. Shaking palsy, tremors. 50 to 60 years, males are predominant. Unfortunately, cause is not yet very clear. It is idiopathic, but pathology is primary degeneration of some cells of the basal ganglia. This is the area in the brain, basal ganglia. There are different groups of the nerve cells. One of the group is globus. Can you see my cursor? Globus pallidus. This is the part of basal ganglia. And there the nerve cells secrete some chemicals, hormones, and that is there is a deficiency of one of the chemical neurotransmitter, and the name is dopamine. Parkinson is dopamine deficiency. Parkinson is a dopamine neurotransmitter deficiency. Some idea should be very clear in your mind. Now, although the cause is not known, following whichever the screen you can see, there are the different things which can contribute addition to the pathogenesis. One is a genetic factor, then accelerated aging, fast aging process. Early becomes old, 40-year person becomes old. So early degeneration, environmental toxins like MPTP and other toxins, overdose of manganese, carbon monoxide, air pollution, and methanol, increased free radicals and iron content in substantia nigra. Some drugs, medicines like reserpine, ethanol, lithium, diltiazem, these have a side effect, tremors like Parkinsonism, neurodegenerative disorders like multi-system atrophy, Alzheimer's disease. Sometimes infection can be the pre-cause, viral encephalitis, and after that you get this convergence of the tremors in Parkinsonism, brain tumor and repeated head injury as in the boxing. Parkinson's investigations, as this is the disease of the brain, do the brain CT scan, MRI scan, here, PET, positron emission tomography, and levodopa drug challenge test. This is not routinely done, but just for your information. Prevention. What you can do for preventing? Number one, Food should be your good in quality and quantity. Shali, old rice, godhuma, wheat, citrus, vitamin C, vegetables, nuts, milk products especially. Ayurveda says, old age, there is a Vata Prakop. So try to avoid Vata Prakopak Ahar and Vihar. Food and lifestyle which will make havoc in the Vata bioenergy, that should be avoided. But cow's ghee is the best for every person, especially senior citizens. After 40, try to make a habit of eating 1 teaspoonful of cow's ghee minimum every day. Of course, there is misconfusion. That means, what about the lipids, sir? Then I have the cholesterol problem. Don't worry, be happy. First, do the lipid profile, check it whether you have a normal level of cholesterol, normal level of triglyceride, HDL, LDL, VLDL. Then you can start. But I assure you, cow's ghee will not make your cholesterol high, definitely not. But cow's ghee can prevent many degenerative changes in the nervous tissue, in the brain. Ghee is the best. Ghee is the best. Don't forget, Dadima, pomegranate, Dadima the Ghrita is available in the market. Lemon juice, mangoes, oranges, guava, apple, peach. Can you see here? Garlic, metabolic stimulant. Asafoetida, also metabolic stimulant, digestant, appetizer. Sprouts. These all things are in moderation, all good. Regular aerobic exercises, exercise with dance, balanced diet, consume antipsychotics or any other psychological medication under doctor's supervision only. Antidepressants, anxiety, don't take for yourself. Rather, I will suggest no medicine should be consumed by anybody of its own, especially the common man. So, my videos, disclaimer, self-medication should be strictly avoided. Professor Deshpande making these videos for medical students, medical teachers, medical professors, medical doctors. These are useful for common man, I know, just to build up the general knowledge. Okay? Then be as active as possible. Avoid yava, barley, peas, vata prakopak, pug, then jambu, jamun, excessive protein diet, hot, spicy food, and incompatible food article, viruddha ahar. One example, milk and acidic food, cross. Milk and acidic food, cross. Viruddha ahar. You understand? Vata prakopak ahar, we are keeping, for example, keeping late at night, excessive physical stress, mental stress, that can exhaust your brain. So, what are the clinical features? Number one, three, triad. Tremors, poverty of movement, and rigidity, stiffness. Tremors, movement loss, and rigidity. Tremors, movement problem, and rigidity. But this is motor problem. No sensory or sphincteric changes are there. Superficial reflexes, abdominal reflex remains normal. This disease is steadily progressive. Sometimes, by your luck, this disease can be stationary, remain as it is for many years, 2 years, 3 years, no change, no progress. That's a good thing. Tremors, about the tremors. This is the first sign noticed in one hand. Okay, noticed in one hand like this. Okay, start with fine and then become coarse, then become coarse. Regular and static at one place, regular and static, manifested in the distal part of the limbs, in the here. Also noticed in the tongue, eyelids, lips, and lower jaw. Sometimes it's rare, but tremors can be observed here. In full blown case, tremor is generalized. Whole body is trembling. So this, in this particular serious condition, like Like you will see patient looks like he is very, very angry. Because of the generalized tremors, patient look like he is very angry in a state of rage or agitation. And that's why the name paralysis agitans. Paralysis agitans, patient looks like he is agitated, he is angry, he is explosive. That's looking like. Tremors can be checked voluntarily. That means if the patient decides stop, can stop voluntarily or by altering the position of limbs. Just ask him to catch this particular glass. When he moves to catch the glass, tremors will stop. Of course, the medicines are there to control the tremors. These tremors are exaggerated during emotions or excitement. This is inversely related to the rigidity. Rigidity increases, tremor comes down. In the beginning, tremors are more, rigidity is less. Then rigidity increases and tremors goes down. Inversely proportional. Stimulates. These movements are looking like simulation, similarity, like the pin rolling cigarette making. Can you see? Or the drum sticking, like drum beating movements. This is called as a peel rolling, Pill, peel rolling cigarette making, peel rolling cigarette making, or drum beating movements. Okay. Poverty of movements. After tremors, automatic movements are first lost. For example, when the patient walks, usually when we walk, our hands are moving. Swinging of the arm is there. But in Parkinsonism, this movement is lost. Longer time is required to take the food. Longer time is required. Speech becomes slow, monotonous. Slurring of speech, consonants, and repetition of the syllable. We, right. Something like this. So this will start with the Parkinsonism. Gait is typical Parkinsonian gait, short shuffling steps. Please check my video on what you can say the different cases, nervous system examination, clinical examination videos are there, and nervous system examination video number 3 on my YouTube channel. My YouTube channel name is Rajendra, then Gap, and then Deshpande. Check the playlist. Many other, what you can say, the people have stolen my videos from my YouTube videos. But you please check my original web YouTube channel and you will be happy. There are more than 550, 600 videos of Professor Deshpande of all the subjects of medicine, Ayurvedic, physiology, pathology, Kaya Chikitsa, Panchakarma, Rasashastra, Vaishajya Kalpana. Many videos are there. You just check the playlist. Face loses its expression. Staring look. I can make some demonstration. Yeah, wait. Can talk, talk. Can you see? No expression. Dr. Deshpande's face is always moving. But if I get the Parkinsonism, face loses its expression. Staring look due to the less blinking. Masked facies. It is called as a Parkinsonian mask. Expressionless. Glabellar tap sign. By clinical hammer, tapping over the glabella. Continuous blinking will be there. Handwriting becomes cramped, cannot make a good sign. Okay. Parkinson rigidity. After tremors, there is a power, movements are lost, swinging movements of the arm, and then muscles become stiff. This also follows the tremor. Cogwheel type rigidity. Specific word is there. Cogwheel type rigidity. Whole body becomes rigid. Fixed neck, trunk, upper and lower limbs, hands and legs. Rigidity is inversely proportional to the tremors. There may be muscular pains or muscular cramps because of the rigidity. Can you see? Typical facies is there. Forward tilt of the trunk, reduced arm swinging, shuffling gait with short steps, rigidity and trembling of the extremities, rigidity and trembling of the head. Pictures are always good to understand. Parkinsonian history, studied and discovered by James Parkinson, 1817, in his essay on shaking palsy. He is the first scientist who has discovered this disease. And then there is a 20th century, some 1990, some all the further progress or the more research had been done on Parkinsonism. Can you see? Brain regions affected by Parkinson's disease. Okay. Here, substantia nigra, pars reticulata, and pars compacta. So these particular things are affected. Okay. This is the global pallidus. This is the global pallidus. Here actually all the things are getting wrong. Neurotransmitter dopamine is less secreted by these cells. Tremors more on the one side, right or left, disappear if the patient attempts to hold something. If I want to hold something, then the tremors will be lost. Expression less face and monotonous speech. Treatment for the tremors, tablet Bidopal, that is levodopa 250 milligram single tablet or 2 tablets gradually increase BD and then TDS 2 times in a day, 3 times in a day. Tablet Sinmet together, levodopa plus carbidopa, levodopa and carbidopa, because levodopa alone may not enter BBB. Write down BBB, blood brain barrier, cannot be overcome by only levodopa. So if we mix levodopa and carbidopa 275 milligram, 1 to 2 tablets 3 times in a day, it will be good combination. About levodopa, what does it do? That increases the dopaminergic activity in the basal ganglia here and controls the tremors and akinesia. No movements, the movement will be gradually increased. Its dose can be reduced if combined with the carbidopa. Should not be used in patients with arrhythmia. Heartbeats are palpitation, tachycardia. Don't use this tablet. Or in the patients of hypertension. So consultation, super consultation, neurological physician, send him, refer him, and then he will decide the another choice in spite of this levodopa. This can cause the psychosis, levodopa, and hallucinations, like imaginary things. He may hear some sound, he may see some visual things, hallucination. This is used for idiopathic and post-encephalitic Parkinsonism, and it is never used in drug-induced Parkinsonism. For muscular rigidity, anticholinergic drugs are given like tablet pacitane, trihexylphenadil. This is generic name, this is brand name. 2 milligram tablets, 1 to 2 tablets, 3 times in a day. Or tablet Disipal, brand name, or Phenadrin, generic name. 50 milligram tablet, 1 to 2 tablets, 3 times in a day. Anticholinergic drugs means atropine-like drugs. They have anticholinergic action and reduce the rigidity. This atropine type drugs always cause the dry mouth, some side effects, urinary retention, tachycardia, and glaucoma. So of course these are the contraindicated for the use of these drugs. If the patient is having already glaucoma, don't use anticholinergic drugs. Okay. Parkinson disease, other drugs, tablet amantadine, 1 capsule OD. This will release the dopamine from the nerve ending, stimulation. Or tablet Celgin, that is Selegiline. This is generic name, this is brand name. 5 milligram tablet, 1 with breakfast and lunch, used alone or with levodopa. These are all allopathic modern medicine drugs. Students will be get benefited in the examination and practice also. Tablet, Trivistal LA, low acting, Piribedil, Piribedil, 50 milligram tablets, 1 to 4 tablets per day with meals. This is cerebral activator and protector as well. Tablet Proctinal, Bromocriptine. This is generic name, this is brand name. 2.5 milligram tablet, 1 to 2 tablets per day. Parkinsonism treatment, physical activity should be encouraged. Warm and passive movement. Some relatives should help. Physiotherapist, helpful for removing the rigidity. Medicines and sometimes surgery, very rarely done. Destruction of globus pallidus. Dementia is a contraindication for surgery. Ayurveda, Kampavat or Vepathu or Kampavat. Treatment is two stages, Avastha, Dhatu, Kshejanya Vata Prakop. Whenever there is more tremors, dopamine deficiency, Kampa, Chala and Ruksha Guna of Vata dosha is increased. Chala and Ruksha Guna. Margavarodhajanya Vata Prakop. Second stage. Second avastha in Ayurveda, when the rigidity, stiffness is there because of the Shita and Ruksha guna of Vata dosha. First, Chalata is more, Rukshata is there, and second, Shita, Stambhane, Shitaha, Stambhana. Stambhana means a permanent contraction, permanent rigidity. So, treatment should be given as per the predominance of tremors or predominance of rigidity. Stage 1, Kampa. Externally, full body, gentle massage, gentle with nutritious oils like Dhanvantaram Kujambu. Kujambu is a specific Arya Vaidya Shala Kottakal. Write down the name. Arya Vaidya Shala Kottakal. Online, everything is available. Dhanvantaram Kujambu best. In Kujambu, oil and heat together. Narayana oil from Shatavari, Asparagus racemosus. Kshira, Bala oil. Can you see? Kshira means milk and Bala, Sida cordifolia. Very strengthening to the nerves as well as to the muscles. Shali Shashtika Pinda Swed. Typical Snehana and Svedana but nutritious. Bruhana. Nasya with Brahmi ghee, Grita. Yes, Basti, Yapana Basti. Rejuvenating Basti is given because all Parkinsonism, neurological problems, moreover, Vata oriented, Vata predominant. Remember this word. Nervous system, Vata dosha. Nervous system, Vata dosha, according to Ayurveda. Three bioenergies, Vata, Pitta, and Kapha. Vata is for movements, Pitta is for transformation, and Kapha is for nutrition and stability. Bioenergies. Internally, when the tremors are more, Brihat Vat Chintamani Ras, very costly. But I have given you that Sukshma Aushadhi from Ayurveda are available. Please check my previous video of hemiplegia. There I have given the specific Vaidya Rajan who is selling this particular manufacturing and selling this Sukshma Aushadhi from Ayurveda. Please see that video already uploaded, hemiplegia. Now you can take this Bratva Chintamani Sukshma Aushad or original tablet, Ashwagandha Churna, Withania somnifera 1 gram, Makara Dhvaja, Ojavardhak, Shukravardhak, 125 milligram, Abrak Basma specific for brain or nerve cells. Abrak Basma is the best nutrition for the nerve cell. Abrak Mayaka, purified, 60 milligram with Brahmi Ghrita or Vidaryadi Ghrita. Ghrita means ghee. For nervous tissue problems, ghee is must. Ashwagandha Arishta and Dashamula Arishta, 4 TSF each with equal amount of water. These are very nutritious aswas and arishtas, medical liquor. Yoga, Anuloma Viloma Pranayama. Anuloma Viloma, alternate breathing, right and left. Vajrasana, Pavanamuktasana, Pranamudra, Okay, do adequate rest, warm, fresh, organic food, organic milk, cow's ghee, carrots, cod liver oil capsules, vitamin D, calcium, muscles should be very strong. Do not do any hectic activity, excessive coffee, no, excessive tea, no, alcohol, no, tobacco, no, smoking, no. Vices are all bad for nervous tissue, of course, for whole body. Stage 2, Avastha 2 in Ayurveda, Stambha, rigidity. This is Avarana Vata, Avarana, Margavarodhajanya Vata Prakopa. Margavarod obstruction is there because current is not coming. Dopamine cannot enter. Receptor problem is there. Avarana is there. On the receptors, avarana is there. Covering is there. Obstruction is there to act the dopamine on the dopamine receptors. Get? Two things are there. One is the dopamine deficiency. Another receptor are having the arm dosha according to Ayurveda. So here more ushna and tikshna dravyas should be used internally as well as externally. Oil massage with moderate pressure with sahacharadi oil, karpasastyadi oil, nutritious and hot. Kaya sek, if person is vata or vata pitta prakriti, kaya sek, pouring of the oil on the whole body, pouring of the oil on the whole body, oil bath. But for the, what you can say, the kapha predominant prakriti, then you can do the udavartana, that is dry powder massage. You can use the kolakulathadi powder or trifala churna. Nasya with strong oil like sahacharadi taila. Vaidyaratnam, this is the company, Vaidyaratnam. Shirobasti, cap, leather cap on the head, sahacharadi tailam. Stage 2, Stambha is there. Then you can use tablet Vishatindakvati, which contains Kapikachu or Kutsala. This is the best nervine tonic, stimulant. This is one tablet, Rasonadi Vati with garlic, one tablet. Then Purna Chandrodaya, one tablet with Ashtavarga Kashaya. Ashtavarga Kashaya, Dhanada Nayanadi Kashaya. Two Kashayas, decoctions. 4 TSF each with equal amount of water. Sahacharadi Sevyam Tailam internal. Sahacharadi Sevyam Tailam from Vaidyaratnam. This is the pharmaceutical company. You can search on the Google. 10 ml with milk at bedtime. Other medicines, Karpasastyadi Tail 10 ml or Bhunag Tail 10 drops with milk or Onan Sudar Tail. Onan Sudar Tail from SKM Siddha pharmaceutical company. 10 drops with milk or Rasna Dashamuladi Ghrita 10 ml with milk. All these can be taken at night. Variety of medicines are there. Variety of medicines. But all these my videos are not for self-medication. Self-medication is not allowed. Then Chandramruta Chenduram. Chandramruta Chenduram. SKM company 25 milligram BD with honey. This is the powder. Then Saraswatarishta, Devadarvyarishta, and Lashuna Kshirapa. Garlic is processed in the milk. Parkinsonism and Ayurvedic research. Modern research, predominantly in India, on Parkinson and Ayurvedic treatment, concentrate on one important herb, Macuna pruriens, that is Kapikachu seed. Kapikachu, which contains natural levodopa, that is easily converted to dopamine in the brain. And this is the advantage of bringing with it few side effects compared to synthetic this levodopa. Synthetic levodopa, this is herbal levodopa. So this can be better used. So this is all about, my dear friends, Parkinson's disease. I hope you have liked this particular my interesting educational video. So you just make it like, share to all your WhatsApp groups and to the mails, and please become a health ambassador for myself, Professor Deshpande, I request by bowing my hands, please you subscribe my YouTube channel and also ask your friends to subscribe my YouTube channel. Okay, so any management is based on ahar, vihar, and aushadhi, dietary advice, lifestyle advice, and medicines. Disclaimer: self-medication is not allowed because these videos are only for educational purpose. Thank you very much. I bow my hands and make a salute for your very nice response. I will continue all these type of medicine classes online. So I have already uploaded the digestive system problems, respiratory system problems, cardiovascular system problems, excretory system problems, and this nervous system problems now. But henceforth, there are many still systems: musculoskeletal system, male reproductive system, female reproductive system, skin diseases, eye problems, ENT problems, then pathology, then pharmacology. Dr. Deshpande has lot to do. But for that matter, I request your cooperation. How? Just subscribe my YouTube channel. I get the inspiration. Thank you very much. See you soon. Bye bye. Take care. Bye bye, my dear friends. Yes, bye bye. Bye bye.